stressed for so long, so stuck in my own way. So I'ma enjoy this moment. It's the day that the Lord has made. It got so hot I thought I wanna die. Blood dripping from my arm, just wanna feel inside. Too afraid to open up, so I'd rather hide. Man, I'm just so grateful that I made it this far. Almost thought I had to call my mama in a cup car. Benny's everything for me and everything I need. I would be nothing if you didn't give me no reason to be. Cause I'm riding through the city.
Alright y'all, as bad as I want to finish this workout, I just want a pulling over here. So I'm probably gonna stop before I do too much. So I'm 27 minutes in. I want to try to do an hour, maybe 45, but I'm gonna listen to my body. Cause we're trying to have no setbacks. So we're done for today. Y'all got out and y'all moved around a little bit and did something. Or just went on a walk or something. But I gotta go. Alright y'all. I'm just happy to be back and really doing something. And y'all got out and did the same. Alright, see y'all later. Alright y'all, so I just did the elliptical. I'm going to do some cardio. I kind of get my steps into. And yeah, I had got like a little sharp pain and a little pulling here. So I decided to stop. Because you don't want to overdo it. I don't want to overdo it. So I'm about to go home. Yeah, I'm going to go home. And yeah, that's it. I just wanted to move, but I also need to pay attention to my body and what's happening, and I don't want to overdo it where I end up somewhere I don't want to be. So I need to ease back into it. Tomorrow might be a rest day. Tomorrow might be a rest day unless I do like a little light walk or something. But yeah, pay attention to your body, pace yourself, and keep the faith, keep trusting the process, and y'all are gonna be fine. Because I know I'm gonna be fine. That was good. That was good. But again, when that pulling and that aching happen, no, we ain't doing that. Let's shut it on down. So that was good enough for me. And, you know, baby steps. Baby steps. See y'all later. Yeah, another day, another whatever. We're here. I like the response I got. And I don't understand healthcare right now, so I'll talk to y'all later. Like, it is what it is right now. Like, I'm just over healthcare. I mean, it's nice. Okay, you will. Let's see where y'all money going. It's a nice room size, nice decent size. They just opened this tower today. But still, I need some answers. They have safes on here. How you doing? You okay? Hi. Hi. Are you ready to go? Me too. What's going on? What's wrong? What's up? Talk to me. What's up? Okay. Hi. Hello. What you giving me that face for? What's that face for? You hungry? You want something to eat? You hear me? Hey, Veronica. Your name Veronica? What's your name? What's your name? You don't know your name? What's your name? Hey? You don't be making that face at me. Why are you making that face at me? Hey? What's going on? Hey. Turn this way. You hungry? Hey, you hungry? Try this. Want some more? There you go. How do I say it? Say ah. You say ah. There you go. Don't bite it, girl. Ah. There you go. Oh, you don't want no more? Okay, that's fine. Oh, Lord Jesus. EMPO, but what do you mean you looking like? What today is? Tuesday? What they got?
Help turn her into bed to like keep the pressure off the wound so it doesn't get any worse and promotes to healing. I think keep just changing the dressing. That's really the plan.
Okay.
Any questions? Yeah. I probably don't have the answers for the questions
I
you
know.
probably want to ask.
I know.
That's That's it. We're done. We're done.
Child, y'all ain't 7-11 to jumping like this. This thing so thick out here. What y'all be doing at the 7-Eleven? Child. Hey, good morning, y'all. So I am headed to get some lab work done. I had a doctor's appointment with the plastic surgeons, but they called and said that he had some kind of emergency. So I'm like, okay, let me just go ahead and get all my blood work and stuff done. And it was for my follow with the consultation and everything, just to see where we are. That way he can submit the new paperwork, because he was right. I was still losing. So I done lost even way more weight. So it's gonna, he has to word it how the, how many grams that they want to take out, because the the insurance company only approved a certain amount because of what my weight was at the time when I started this process, and I'm nowhere near that weight I originally was. So, yeah. My stomach is hurting a little bit, y'all, and while I'm here, I don't know if I want to go in and check in, or because I got to go to work. So I'm just gonna, I don't know what I'm gonna do, but I'm gonna get these labs done. I really need to get them. They're post-op labs from Dr. Yuko. I was like, let me just go ahead and get them done just to see what my blood is looking like and where we are. For these labs, they tell you to stop your vitamins. So before, I haven't been on vitamins for a couple weeks, so my bariatric vitamins. So I know they should be good and ran out of my system. So let's go. Yeah, I just realized this first time I'm wearing my Crocs out in public outside my uniform. I don't do this. What was I thinking this morning? What was I thinking? If we can get something. Big book. Relax your hand. Did you really get that in one stick? Mm-hmm. Okay, you're good. Nobody ever does. You're amazing. They usually have to bring in the ultrasound and the whole piece team and everything. No lie. Okay, I know who to call. Who am I calling whenever I come here again? What's your name?
Leanne.
Say, get Leanne on the line. Get Leanne on the line. That's crazy.
You doing okay?
Yeah.
Okay.
Okay, that's burning.
It's burning?
Yeah.
Switch tubes.
Oh, yeah. Ooh. So I am too dehydrated. She was only able to get maybe one or two, only 2 tubes. And I had like maybe 6 or 7 to get. So let me check in and get some fluids. Gosh, yeah, look a mess.
This blood came out great.
Yeah. Give her some pushback, please. Yeah, feel like deja vu, girl. Y'all, so I came in to get some labs, post-op labs done finally, since I had a late start to my work day because one of my doctor's appointments got canceled. So I got here to get my labs done and everything, and yeah, they couldn't take them. They said I was severely dehydrated, and I have been ignoring my stomach pain, to be honest, for the past 24, 36 hours. I thought I just kind of pushed a little too hard in the gym. And yeah, so they sent me right over here to the ER. So they finally got a line going after poking me so many times, y'all. I've been poked like 6 times. And I'm just getting some fluids. My abdomen is really tender, so we're gonna get a CT scan going, and because they want to make sure that everything is healing properly, there isn't anything wrong. And I'm learning to listen to my body. So y'all, listen to your body no matter what. It could be absolutely nothing, but it's better to be safe than sorry. So here I am, where I'm spending my morning, and I'm looking raggedy as heck because labs were supposed to be in and out, and I was supposed to be going back home, getting ready for work, and starting my day. I've been here now since like 7 a.m. and yeah, so hopefully I'll be going to get my scan soon, again, because they just want to make sure that everything is okay and nothing else is going wrong, and get me certain fluids in, because y'all feel like I'm chewing on cotton. I'm very lethargic. I have to admit that, even with trying to keep up with all my fluids and everything that I've been trying to do, y'all know I've been trying to do that. So look at my hair, y'all. I'm just looking a whole hot mess. But hopefully once this bag runs, they just got it started, and she's gonna see what outpatient labs, if they can go ahead and finish the labs that I was originally supposed to get this morning, because the lady was only able to get 1 tube, and y'all know how those post-op labs are. It's like 8 tubes of different things that they have to get. So she's like, so we don't have to poke you again. Hopefully we can get that done. But y'all, that's just where I'm at. I wanted to update y'all, but hopefully I'll get this scan done and I'll be going home. All right, see you later. All right, y'all, so update. Very constipated, as can be expected. They said my white blood count is really low, so I need to pay attention to that. It's kind of trending really low for some odd reason. My potassium is low, so they're about to give me a treatment for that really quick before I leave. What else is going on? Yeah, I just need to stay hydrated. Follow up with my primary regarding, you know, my count. She's like, maybe it can be genetic, maybe it can be a medication or something that's affecting it. But from a year ago and a few months ago, it is trending lower than what it was before. Nothing to be too alarmed about or pay close attention to, because the number of that just keep dropping, and it could be something dealing with my bone marrow and how that's affecting everything. So just pay attention to that. So that's about it. They want me to continue to follow with GI, follow with my primary, incorporate more foods with potassium in it. And that's basically it. Take it easy. Still don't try to overdo too much. And that's it. She actually told me to go take some magnesium citrate. I took that a long time ago, but I may go get some. And that's it, y'all. That's the update. So they're gonna come in here and give me a potassium treatment, and then I get to go home. Well, go to work, because I'm going to work. I shouldn't, so hey, it is what it is. All right, bye. All right, y'all, so now that I think about it, I really be trying to ignore certain things. My legs really have been hurting and like cramping and like the muscle tightness and everything, and me not even trying to correlate the two things. That's a sign of low potassium. So I'm on my way home. Well, I'm just leaving here. Probably gonna be going home, not right now, but I'm gonna go in a few minutes because I'm going to work. She told me to take the rest of the day off or go back to work tomorrow or Friday. I don't know what to do, y'all, but yeah, they told me to take some rest, try to take it easy, incorporate more foods with potassium. Again, follow up with GI, follow up with my primary regarding, you know, still having the constipation, having the abdominal issues. As far as my skin, she's like, everything looks like it is fine and it is healing properly how it should be looking there. So that's a good sign. And, you know, just taking care of this other part and, you know, proper rest and staying hydrated and things of that sort. But other than that, I am a little tired, y'all, but I gotta go to work, so it is what it is. All right, y'all, so I am just leaving, and yeah, so diagnosis, of course, is constipation, which showed up on the CT scan. It's a chronic constipation, hypokalemia, and leukopenia. And I think I'm saying that. Leuko, of course, is dealing with the white blood cells. The hypokalemia is dealing with my potassium being as low as it was. So I finished that treatment, and they're telling me to take it easy, go get some rest, and follow up with the primaries and all of that for so they can keep a close eye on my WBCs, because, you know, Lord forbid anything happen, like if with it being that low, because I was looking at the numbers, it'll be hard for my body to try to fight off any infection or anything like that. So I've never been through this in my life. She's like, it could be genetic, it could be from some medications, you know, we just never know how I got to this point. She was like, from last year to this point, it's been trending, it's been going really low. So it's just something to keep an eye on. And of course, over the past few months with everything that's happening, she sees a trend of it lowering. So yeah, that's something I'll follow with my primary doctor about, just so we can keep eyes on it and just continue to get those necessary labs and blood work completed. I'm glad I followed my first mind. I went today, because I probably wouldn't have known that. Like, I literally had to get a potassium treatment. You know, with your potassium being low, if it gets to like dangerous levels, you know, it affects your heart, it affects a lot of things. You don't just have muscle cramping, which I just said this even when I was in North Carolina a couple weeks ago, what, 2 weeks ago now. I'm like, my legs are really cramping, like my muscles, like everything just feel real crampy and achy. Not trying to correlate or put two and two together, I wasn't. So yeah, that's where we are, guys. That's just an update. I did notify my job, so I told them I will be out for the rest of the day. I'll go in tomorrow, but yeah, that's it. So yeah, I'm going to update y'all, and I will see y'all later, okay? Nice. A lactation pod here. That's pretty darn cool. Mother. Hey. What's wrong with you? What's going on? Hey. What's up? Look, it's applesauce. It's Veronica. So we're here now. She's actually getting blood transfusion. And this is her normal. Yeah. Alright, y'all. So I literally had to give a report to this doctor because I'm asking him to do scans and everything, and she kind of had up in her mind she done got a report from everybody else. My mom is not here just because of a pressure ulcer. No, this is what's happening. I had to literally sit this doctor where she was standing, and then when I telling her what has happened, like what landed my mom here, and then I show her a picture of how my mom was just 6 short weeks ago, this doctor literally plopped in the couch, in the chair, and was like, wow, no way. Yes way. Yes way. What do you mean? This was my mom 6 weeks ago. So because at first she was pushing back on it, because I'm like, okay, I'm requesting that we have another CT done, a CT scan or an MRI or something to be done so we can see, okay, what's going on with her brain function. And she was like, well, I know someone over there at the hospital at HCA. Let me see if I can get them to send me the reports. I already have somebody on it, because she pulled out her phone and she started texting right away. So y'all have to fight for y'all family. Like, don't be afraid to speak to these doctors and let them know, like, well, regardless of the report that you're receiving, no, this is what's happened. This is her history. This is not, because everybody's like, is this her normal baseline? Y'all see my mom. It looks like my mom has aged in 1 month 20 years. So she's not speaking, as you can tell. You can hear her. She's not walking. She's not talking. Nothing. So, yeah, I have to let her know. And everybody, I'm like, I will show these pictures till she's out of here or in a better state, because y'all ain't finna think like this is just my mom. This is just what's happened. And she was like, I had no idea. Yeah, listen to me. So I don't mean to come off as a B or rude, but one hospital has already failed her, and I'm not about to allow that to happen here. And she's like, no, I totally understand. I get it now. Yeah, I bet you do. Like, no, ma'am, this is my mom. This here is not my mom. So I need y'all to understand that and keep this picture and the story that I'm telling you in the forefront of your mind when you're taking care of her. So now she's putting in an order for a CT scan. She was like, they don't even have any reports that speech or anybody therapy related was going to see my mom in the hospital. I'm like, I can believe it, because that's why she has this freaking pressure sore as big as my ass on her ass, you know? So yeah, it's crazy. Like, healthcare, going through this, I'm ashamed to say I even work. I'm not ashamed to say it, because there's no way I would treat somebody's family like this. I'm gonna treat my patients like this. Like, there's just no freaking way. No freaking way. And it's just sad. It's been a sad situation. It's sad to explain it to these doctors. A lot of these doctors, they're so used to just being in this whole mundane of their job that a lot of them don't stop to take a deeper look at what's happening or what's going on. Because now she's like, we were just told that it was one condition. And I'm like, no, she was diagnosed with this there in the hospital. I had to catch this. As y'all know, I had to catch the seizures. I had to catch the strokes. That's what's happening. It was like, she had a stroke. How do y'all not know this? How did Memorial not send these records over to these doctors saying like this was what's happening, or what their findings were on a CT and MRI? I'm kind of questioning it now, because she was like, I didn't even see a report for that. What the hell was Memorial doing? Okay. So before I get worked up, because I just got back from the hospital. I just had to go to the ER. I went for a follow-up. And my doctor sent me right over there to the ER to get some fluids, to get some other things. So before I work myself up, I'm gonna calm down and I'm gonna end this vlog, because healthcare is just shit. If you do not fight for yourself, you don't advocate for yourself, you don't advocate for your loved ones, it's just sad that this is where we are in this country as far as healthcare goes. Like, a lot of providers are just in it for the dollar. A lot of them are just in it for the money and the status, and they forgot the initial essentials for what it takes to be a healthcare provider, to provide care to somebody. And it's just sad. But all right, y'all, let me go. The rain done eased up because it was just storming, so I'm gonna go ahead and get out of here, because I know the doctors told me to rest. They actually want me to take off the rest of the week, but I'm not. I'm going back to work tomorrow. Like I said, I'll take today off, but that was about it. Hi, how are you? Yes, I am. Hi, how are you? Yeah.
Just coming to see if
Oh,
you were
good.
able to
I
sign.
did.
Perfect.
Yeah.
I'm gonna go make a copy to bring it.